coming at you from my bathroom. I recently shared that my husband and I are expecting our first baby, and because skincare is the main thing I talk about on this channel, I kind of wanted to update you on how I have changed and adapted my skincare routine to fit this new, really exciting chapter of my life. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist. I'm here to help you understand your skin and find skincare products that work for you. If you like what you see, like this video and subscribe to the channel. Before we get too much into this video, I want to say you don't necessarily have to change your skincare routine during pregnancy. Of course, you want to take a step back and just make sure all the ingredients that are in your routine have not been shown to cause harm to an unborn fetus. Obviously, we would want to eliminate those from our skincare. The other thing though is changing your routine only if you really are noticing your skin changing during pregnancy too. And it's very common, I see this all the time in my patients, that their skin will shift during their pregnancy. They'll either become more oily or more dry. They might notice increased acne breakouts or fewer breakouts. And then a lot of women can also become more prone to hyperpigmentation and melasma. And so just making sure that you're not keeping your routine for the sake of, oh, this is something I always do, but that your skincare is always intentional. So I have shifted my routine a little bit now that I'm pregnant and my skin is changing. And I plan on adapting my skincare routine as my skin continues to change through my pregnancy and in that postpartum period. I also want to say that although I'm talking about what I do for my skincare during my pregnancy, and I am a board certified dermatologist, I'm not telling you that this is exactly what you need to do during your pregnancy. And if there's ever a skincare ingredient that I'm talking about while I'm pregnant and you're not sure if you feel like you can incorporate that into your routine safely, always check with your own physician, okay? That's really, really important. On the other hand, as a board certified dermatologist, I feel that I'm very up to date on the latest guidelines in terms of what is considered truly safe during pregnancy, what is considered unsafe during pregnancy, and also what is in sort of that nebulous in-between land where maybe we don't have enough clinical data to say whether or not it is 100% safe or not safe. And I feel like when an ingredient lands in that category, it's really important to just take a step back, look at the data, and understand what is the risk and benefit of incorporating this ingredient into my skincare routine. So everything I've chosen to use on myself, I have weighed the pros and cons, and I encourage you to do the same. All right, enough disclaimers. Let's get into it. First thing, gotta get the hair back. So in terms of how my skin has changed during this first half of my pregnancy, the big things that I notice are, one, I have a lot more congestion in my skin. So just a lot more texture, especially on the lower part of my face. And I really attribute that mostly to eliminating a retinoid from my skincare routine. So I have used retinoids regularly in my skincare routine, probably for the last decade of my life. And so abruptly stopping those, because those are considered not safe for use in pregnancy, I think has been the biggest contributor to why I feel like my skin has felt so much more congested. The other things I've noticed is that my skin is just generally a lot more dry and flaky, so I have to be careful in terms of how much moisture I'm putting on my skin and really just kind of up my game a little bit more. And then the last thing I've noticed is that I'm getting a lot more post-inflammatory hyperpigmentation. So when I do get an acne blemish, which luckily is not that often, I find that it leaves a mark that is lasting a lot longer than usual. I'm also prone to developing melasma. Although it's been a few years since I've dealt with it. In the past, when I was on an oral birth control pill, I did have melasma on my cheeks and on my upper lip. So I know my body is capable of making that type of pigmentation with big hormone shifts like being pregnant. So a lot of my skincare, not just my evening skincare, but also my morning skincare, is really focused on preventing overproduction of pigment in my skin. So we'll get the headband on. I feel like every time I use these on Instagram, you guys ask where I get them, and I buy them in 3-packs on Amazon. I think they're just called like spa headbands, and they're awesome. They work perfectly to keep water off of my hairline. I'm gonna start off with my usual, which is a double cleanse. Unlike some of the other types of skincare that I'm trying and testing, which I usually like to use for a minimum of 4 weeks to kind of get a sense of if I like it or not, cleansers are something I'm constantly trying because I can really get a sense pretty quickly whether or not it worked to remove my makeup and remove my sunscreen and whether or not I had a bad reaction to it. But recently, I have really been loving the Pharmacy Green Clean Cleansing Balm as my first cleansing step. If you've hung out with me me on here at all, you know that I love micellar water as a first cleansing step, but I have been leaning a little bit more towards cleansing balms and cleansing oils lately, just because I find that I've been wearing a little bit more makeup. And so rather than having to go in with multiple wipes of micellar water when I'm wearing heavier makeup, I think cleansing balm is just nice because it can eliminate a lot more product more quickly and more efficiently. So this Pharmacy Green Clean Cleansing Balm, I like to keep the spatula in the jar if it fits because it just makes it easy. It is really like your classic cleansing balm in terms of its sort of sorbet-like texture. So I like to put a healthy amount onto my palms. And the first thing you really want to do is just warm it up in your hands. And a good cleansing balm should generally melt down pretty quickly. So it's basically, it looks completely gone. It's all here. And then I just start to work it into my face. I like to do kind of the periphery of my face first and then do my eye makeup last because my eye makeup gets everywhere and I start to look super terrifying. So I'll just shut up and do this step. You still want to be really gentle around your eyes. So even though I'm making lots of little circles, I'm barely putting any pressure. You just want to lift it up under the lashes too, because I find mascara and eyeliner tend to be the trickiest parts to remove in terms of makeup. Wow, that's terrifying. Okay, that's my nighttime routine. See you next time. Just kidding. After you can see like the makeup is really broken down, the raccoon look is what I need to see to understand that, yeah, okay, I'm at a good place in terms of my cleansing balm working. So the next thing you wanna do is get a little water on your hands and just sort of emulsify that balm. It should turn into sort of like a milky film on the skin. And then once you have emulsified everything, then you can go down and rinse. So I'm gonna do that now. I'm back. So I really love that cleansing balm because I think it's highly, highly effective at breaking down makeup and eye makeup in particular. It smells like a lime popsicle. So for people who don't like that like candy, lime candy type smell, you might not love this. There's also botanicals in here. So if you have really sensitive skin or you can't tolerate certain fragrances or essential oils, that might not be the first cleansing step for you. But for me, it has very much agreed with my skin. And now I am ready to go in with my second step of my double cleanse. For the second step of my double cleanse, I am going to be using the La Roche-Posay Hydrating Gentle Cleanser. I have been using this for a while and probably will continue to because this bottle is enormous. But this is just a very gentle cleanser, and like it says in the name of the cleanser, it's hydrating. So use about a pump. It's a very like milky cleanser. Get it a little bit wet here. Really the point of the second step of the double cleanse is just to remove any remaining residue. So for me, it's just like a double check that you got everything off. Could you just do a single cleanse? Certainly, but I find that my skin responds best to a double cleanse. A lot of people will say, well, can I just use my water-based cleanser twice rather than having two separate cleansing products? And yes, you can, but I think if I went in twice with this, it wouldn't break down all of my makeup. So that's just something that I'm trying to be mindful of. So I'm just massaging this into my cheeks, neck, around the eyes, but all that eye makeup is gone. And then I get to go down and rinse this out. All right, so now my skin is fully prepped for my leave-on products. You can see a little more of what I was talking about earlier. So I've got my rosacea patch, post-inflammatory pigmentation here, my little lower facial breakouts, my incoming melasma mustache, just overall feeling really confident about my skin these days. So even though it can be really frustrating to undergo some of these negative skin changes during pregnancy, I think it's really important to step back and look at the bigger picture. I'm growing a human being inside of me. My body has to change in order to accommodate that, and your skin is one part of that. And so I understand that my skin might not be perfect right now, and that this is a phase in my life that really should be savored and loved, and it's so special. And I don't want to get fixated on these little changes in my skin and body that bug me, because that's not what's really important in the grand scheme of things. So I'm going to be choosing really intentional skincare to try to tackle these problems as best I can, but also understand that this is all transient and that my skin will rebound after pregnancy as well, and just not to be too judgmental or too negative about what my skin is doing during this time in my life. So For my first step, I'm going to be using the Naturium Tranexamic Topical Acid 5%. This also has kojic acid, niacinamide, and licorice root. And the real point of topical tranexamic acid is to help with unnecessary pigment formation. In my clinic, when I'm treating patients with melasma, I will often prescribe oral tranexamic acid, so in pill form, for people who have severe melasma that is maybe too stubborn to respond to some of the topical things we might use. But I'm not going to use oral tranexamic acid during my pregnancy, although it is safe. I'm gonna stick with topical. So this was sent to me in PR a little while ago, and I was like, you know, I'm not really struggling with pigment. I don't really have a place for this in my routine. But coming into pregnancy, I'm like, yes, please give me all the help I can with pigment. It's like a golden serum. And I like to use serums as kind of my first step because they're quite thin and I find it's easier to layer on top of them, which is why I've chosen it as my first step. I tend to work thinnest to thickest, unless I have a prescription product, in which case I usually put a prescription product on first, but I'm not using any prescriptions here tonight. So I like to kind of distribute that evenly in my fingers, and I start the application on the areas of my face that I need it the most. So upper lip, cheeks, and then kind of blend outward. So the other things in here, like the kojic acid and the licorice root and the niacinamide, they've all been shown to help with pigment as well. But I just think it's amazing that this is a 5% tranexamic topical, because there are other brands who make things with tranexamic acid topically, SkinCeuticals, SkinMedica. Those are often sold in dermatology offices. We carry SkinCeuticals in my office, but those can be at a slightly higher price point. And so the thing I like about this is that it's really affordable. So now that that very lightweight serum has sort of been distributed, my skin feels a little bit tacky, but honestly it dries down in like 30 seconds. So I don't feel like I need to wait a lot of time before going in with my next skincare step. And maybe because I was talking about the affordability of that serum is because I knew the next thing I was going to be putting on was definitely a pregnancy investment. That is the Allies of Skin Mandelic Pigment Corrector Night Serum, which is amazing. I am a huge fan of well-formulated products that combine multiple active ingredients. So although I'm a dermatologist and I love skincare and I feel like I know a lot about skincare ingredients, I understand what my limitations are. I'm not a cosmetic chemist. My specialty is not combining active ingredients to make the most effective topical. And so I'm willing to invest a little bit more in these combination serums because you get a lot of power and efficacy out of them. That is what I love so much about this particular product. So there are so many amazing goodies in this bad boy. Comes out, kind of looks like a caramel, slightly thicker serum than what I just put on. So first of all, this has lactic acid and mandelic acid, which are both alpha hydroxy acids, but they are larger molecules than glycolic acid. And so they don't penetrate as deeply into the skin, which makes them a lot more gentle. And for me, having rosacea, I could not regularly use glycolic acid without having a lot of irritation. So this still gives me some benefits, exfoliation benefits and hydrating benefits of alpha hydroxy acids without having to use something quite as intense as glycolic acid, although I do love glycolic acid in pregnancy as well. This serum also has salicylic acid, which is a beta hydroxy acid, and that helps with exfoliation as well, but it has this added benefit of being able to penetrate into the pores a little bit better. So if you're someone who struggles with blackheads or congestion, like I have been struggling with, then having that salicylic acid as part of the serum just gives it a little extra oomph. Salicylic acid is generally considered very safe in pregnancy. Most people will say that up to 2% is considered completely safe. I think as a dermatologist, I've certainly used stronger strengths of salicylic acid in certain pregnant patients. But again, that's always going to be a conversation between you and your doctor or me and my patient. One other ingredient I wanted to highlight in this serum is an ingredient called Bakuchiol. And Bakuchiol has become quite famous in the last several years because it has been shown to have similar clinical efficacy to topical retinol in terms of the reversal of photoaging, so the reversal of signs of aging caused by the sun. Bakuchiol has also been shown to be less irritating than retinol, which is another one of its benefits. But we can't use retinol while we are pregnant, and the reason for that is because retinol is a vitamin A derivative, and we know that certain oral forms of vitamin A can cause significant birth defects when taken by pregnant women. And so because those birth defects are legitimate and very well proven, we don't even mess around with topical forms of vitamin A during pregnancy out of an abundance of caution. But that gives a nice opportunity for other anti-aging topicals like Bakuchiol to kind of take their place during this time in our lives. And you might be thinking like, okay, Dr. Ellis, well, if Bakuchiol Bakuchiol is so great. Like, are you ever gonna go back to using your topical retinol or topical tretinoin after pregnancy? Yes, 100%. I actually did one of the original studies with Bakuchiol and wrote the paper on it. So although I recognize that it can be very effective, I also recognize that that is just one study compared to the incredible amount of very great data we have about tretinoin and other topical vitamin A derivatives. So although I think Bakuchiol is great and it's a great alternative during pregnancy, I also think retinol and other retinoids have an amazing place in skincare, and I will be reincorporating those into my routine as soon as I can do so safely. All right, time to lock in all of that goodness with a thick, creamy moisturizer. Like I said, during pregnancy, my skin has been very dry, so I have really been craving something quite rich. The moisturizer I have been loving lately is the Dermatology Peptide Night Cream. This is sort of a thick, I want to say whipped, sort of like a marshmallowy texture, rubs in really well. It just feels delicious on the skin. It's the only way I can describe it. Like, it is very rich, but still doesn't feel super thick or heavy. And that's the thing I've loved about it the most, is that you get the moisturization that you want out of a thick night cream without that like thick night cream feel. And oh my gosh, this is hard to rub in while looking at the camera, but don't forget the neck. I've loved this moisturizer a lot, and I even feel like on days when I feel dry in the morning, I also put it on in the morning under my sunscreen, and it works great for that as well, even though it says night cream. Once the moisturizer is on, the last thing to pay attention to is lips. I think lip care is often neglected, but really important. The skin on your lips is so thin, and it doesn't have the same oil producing capacity that other parts of our body do. So it really needs that added support. And today I'm going to be using the Laneige Lip Sleeping Mask, which is just one of my all-time faves. When I first got this in the mail, which was months and months ago after I bought it, I was kind of disappointed, like, oh, this is so small. And I've used it every single night and it's still going strong. So a little goes a long way with this bad boy. So this has quite a sticky texture, which I don't mind at all. It really helps it last on the lips, which is why it's a lip sleeping mask, because it stays in place all night long. The only downside is that my hubby doesn't really want to give me any smooches after I put this on because it is a little bit sticky, but you know, we all make sacrifices for good skincare, right? Okay, that is my nighttime pregnancy skincare routine. If you want to see my morning skincare routine during pregnancy, put that in the comments below if you want to see it. Also, I'd love to know if your skincare routine changed at all during pregnancy, and if so, I want to hear about it in the comments as well. Please like this video and subscribe to the channel. It really helps me out. Come follow me on Instagram at Dr. Samantha Ellis, and I'll see you next time.